Some symptoms of back issues, like I said before, muscle aches and pains, just general in the muscle area that don't radiate elsewhere. Shooting, stabbing across the back can occur with just general back pain going across there. If there's arthritis or anything like that, that can just cause some tightness going along those muscles, which are trying to respond to the pain going inside the joint of the spine. And pain that radiates down the leg, either above or below the knee. You can have numbness and tingling, as well as the pain, as well as weakness. And as those symptoms get worse, you'll actually notice that you'll have more leg pain and not even possibly any back pain. So that's kind of confusing for some people, because a lot of times we see patients that come in and they say their leg hurts, but then we have to explain to them that because of the nerve compression going on in the back, the pain in the leg is actually coming from the back and not something going on into the leg. You'll also find that you'll have pain in various positions, whether it's prolonged sitting, prolonged standing, or prolonged walking. So how does this impact your life? It can impact your life on so many different levels. So you can't stay in one position for too long. You have to change positions pretty often. You can sometimes get pain trying to get comfortable at night, and then when you finally get comfortable at night, if you tend to move in your sleep, then you might get pain that wakes you up at night. Things like getting bathed and dressed, so taking a shower, or getting dressed, trying to pull your leg up, trying to bend over to put your shoes on, might actually cause pain. So those can definitely impact your life. As well as that, weakness in the legs. If the nerve compression gets worse, you may find it difficult to negotiate stairs or even walk distances greater than about 5 to 10 minutes, because if there's weakness, then your knee might start to buckle. And then also your foot could actually have something called foot drop, and that pretty much means your foot kind of slaps down onto the surface as you're walking because there's no muscle control. So take note of that, because that's pretty important to realize, because if it gets to that point, then the compression is really severe. Also recreational activities. I mean, if you can't do these different movements because of either weakness or pain, then you're not going to be able to participate in any of your recreational activities, let alone just walking, sitting, standing, those things.